find solutions to combat the outbreak that we are currently facing. Knowledge sharing becomes more crucial than ever for the entire community. The COVID-19 pandemic has set many norms for the entire world, with the healthcare industry leading this change. While telemedicine has been around for more than 2 decades, it is now only now that its full potential is being accepted, understood, and utilized in India. Technology has made it possible for people to access healthcare without having to travel or risking a potential exposure to infection. It has changed the way primary healthcare is now being delivered. There is a greater acceptance and attention for digital health solutions during this coronavirus crisis, and we believe the trend will continue even after the pandemic. Doctors have never been more supportive of this digital technology than now, and patients are slowly getting used to telemedicine as the new norm of healthcare, accessing healthcare. Did you know 50% of the users who have consulted through telemedicine are for the first time after the outbreak? The objective of today's webinar is to understand the misinformation with regards to the coronavirus pandemic, especially the second wave. And I would like to welcome our for today, expert for today, and thank him for joining us, who is Dr. Rajesh Bharatwaj, a well-renowned senior ENT consultant. But before we start, let me explain how you can interact with us during the webinar. If you have any questions during the presentation, just write them down on the chat. We will have a Q&A session at the end to answer your questions. We will send you all the relevant links after the event, and including the link for the webinar recording. So, Dr. Bharatwaj, I hope you're ready, and
Yes.
we can start addressing and discussing what you have in your mind. So the first question that we have here is, what is the difference between the second wave? What is so different about it, especially in India?
Dr. Ajay, good evening. Thank you so much for having me here, and my greetings to our viewers. The question about the second wave is, the first and foremost is that which all of us understand is that it caught us by surprise. It caught us by surprise because we had thought we had conquered COVID. We went about business as usual. We let our guard down, and that has cost us very, very dearly. We are paying a very heavy price for the second wave. The second wave is definitely a more transmissible form of wave. The symptoms have also changed. In the earlier part, if you remember the first wave of COVID-19, loss of sense of smell and taste were the initial symptom, followed by fever, a slight cough, and maybe if the disease progressed, then some breathlessness. But in this present lot that we are seeing, first of all, the virus seems to travel straight to the lungs. So symptoms related to loss of sense of smell and taste are there, but much less than the first wave. Secondly, it is affecting the younger people as well as children. Today itself, I have treated about 3 children who have been affected by COVID-19. Whether this is the fact that the elderly have received their first and second dose, or there is a difference in the virus, we are yet to ascertain that. We are not very sure about it. This virus definitely causes more fever. I am seeing patients who, even on day 14, are febrile. It causes more cough, and definitely breathlessness is also more. So our treatment strategies for this current lot of infection is definitely a little different from what we were doing for the first lot.
Thank you, doctor. So the next question that we have here is, we have been hearing about the double mutation and recently the triple mutation of the virus. Are there any new variants that we need to look out for? And if infected with COVID-19, can I still not have any symptoms?
So let's take this part by part, Dr. Ajay. The first
Yes.
thing is the mutation. I really, these are genomic sequences, and there's no reason for us to get into that complex part of it. We have to understand the practicality. Practicality for us we have to understand when the virus is changing, when it's evolving into or evolving into a different kind of virus, there are three things we want to know. It's obvious. We want to know, does it transmit more? Secondly, we want to know, is it more virulent? And thirdly, the most important question, we want to know, do the vaccines still work against it? These are the practical considerations related to the mutant strain. So first of all, definitely this virus is more transmissible. People have, there were initial cases in the first wave when maybe one person in the family would be positive, the others would be spared. No longer. Now we are seeing largely, once one person is positive in a household, largely the whole household or the whole family becomes positive. So obviously the virus is much more transmissible, more virulent. We don't know by and large. The case fatality rate seems to be the same as the first wave. Fatality, I think, has remained the same, though symptomatology, patients are more symptomatic, but I don't think it is more virulent. But the jury is out. We still need more research to find out whether that is true. And thirdly, the vaccine, it's fairly certain, even if the vaccine does not offer full protection, the vaccine will continue, both the vaccines that we are currently using will continue to be effective against the mutant strains.
Thank you, Doctor.
Regarding your second question, yes, we still have asymptomatic, and so there are two categories to this. One is pre-symptomatic, that is, the virus has come into my body. Now the virus is there and it will start replicating. And before it multiplies, I am carrying the virus, but I'm pre-symptomatic. But over a period of time, I may develop symptoms. The second is the truly asymptomatic patient. The truly asymptomatic patient is the one who has the virus, is transmitting the virus, but shows no symptom. And this actually is one of the main causes of the spread of the pandemic is the asymptomatic patient, because there is no reason for this person to test herself or himself. There is no reason for them to seek medical advice because they have no symptoms to begin with. And this is one of the reasons why the pandemic has spread, one of them being through the asymptomatic patient.
Moving to the next question. Are the new strains airborne? Do masks really help them?
So, Dr. Adi, if you remember, this is a very pertinent question because it has, in some manner, we have changed our approach to the virus. In the first instance, if you remember, we were told to clean surfaces and to disinfect surfaces, and various agents came out to help us with that. And there were various figures and statistics that were shared with us that it remains on a plastic surface for so long, on cardboard for so long, and on metals for so long. But the recent research, particularly the article that came out of United Kingdom, clearly points out to the airborne method or the droplet infection method as the primary source of spread of the virus. And that surface transmission is, you will be very unlucky if it is transmitted to you via surface. So ultimately what becomes more important is to keep our air clean rather than our surfaces. Surfaces, yes, we need to be careful, but most of the time we need to keep the air clean. And that is why we have been recommending keep your doors and windows open, ventilate your rooms well, avoid indoors. So if you have, in places like Delhi, it is no longer possible because we are under curfew. But if you're lucky enough to live in a place where you can go out and meet people or maybe go to a shopping complex, try to stay outdoors as far as possible. Seeing the nature of transmission, outdoor is safer than indoor. So the virus is largely airborne. The transmission of infection is largely by droplet infection, and we need to be careful about that. And that is why the mask. Now, regarding the masks, there are so many queries that patients have. First of all, masking is better than not masking. Secondly, in category wise, N95 is the most effective mask that should be reserved for healthcare workers, or if you are taking care of a COVID positive patient in the house, then you should wear an N95 mask to protect yourself. The second is the 3-ply mask. This is a good mask. This is a safe mask. We recommend that you wear it. And the lowest category of mask is the cloth mask, which you can make at home. The advantage of the cloth mask is that it's readily available. You can stitch it at home and it is reusable. So there is also now a concept of double masking, particularly if you have some allergies to a fabric, you can use the cloth mask underneath and then cover up with a 3-ply mask. The advantage of that is if there is any uncovered surface with one mask, The second mask will help to cover those areas so that you are more protected and persons around you are more protected. The concept of mask is not just to keep you safe. The concept of the mask is also to keep others around you safe. And we have consistently seen if two persons are well masked, the transmission of disease is very, very rare.
Thank you, doctor, for the insights on the masks. Moving to the next question. Is the RT-PCR test failing to detect the newer strains of coronavirus?
Again, Dr. Ajay, this is a very relevant question because we are seeing patients who are showing the classic symptoms of COVID-19, but the RT-PCR is turning out to be negative. Now, there are three situations in that. First is if the tester was not careful, if the technician who came in did not, because maybe you were uncomfortable, you did not let the tester put the probes inside well enough to go all the way to the back of the nose. So one could be a tester error. Second is that it could be too early in the disease. So as soon as you get your first symptom, if you test immediately, it is possible the viral load is not enough to be captured and you may get a false negative. The third, and the one that we are worrying about, is the new gene sequence causing false negatives because the RT-PCR is not picking up? We are not very sure of that, but we have certain other things to do. If the RT-PCR is negative, but we still feel the patient is positive, one of the things we can do immediately is a rapid antigen test. The second thing we can do, particularly if the patient is showing symptoms of cough and breathlessness, is a CT scan. A CT scan, I would not advise you to do it on your own. It must be done only under medical advice. And if you find that you are RT-PCR negative and that there are chances that your infection is getting progressively worse, then a CT chest is sensitive enough to pick up changes and tell us whether you have COVID-19 or not.
Thank you, doctor. So moving to the next question. Can we move forward to the next one, please? I think we have covered this. Yeah. What exactly is oxygen saturation and what should I do with respect to COVID-19?
So oxygen saturation basically is how the body functions. It's the hemoglobin is the oxygen carrier in the red blood cell. The oxygen is transported by blood to various organs, and once it reaches the organs which are hungry for oxygen because they depend upon oxygen for their survival, take the oxygen and live off it. Oxygen concentration in the normal adult is normally about between 97 and 99%. Our consideration in this particular instance with this present COVID-19 is 94 and above is good. 90 to 94 is good, but you should start now looking around for either a concentrator or an oxygen cylinder or upgrade your medication because your lungs are getting affected. And if you are lucky enough to live in a city where a hospital bed is available, maybe you should start seeking, not immediately, you should start seeking a hospital bed, or if there is a queue or a waiting list, you should start putting yourself there. When your SpO2 falls below 90, that is when we would start being a little worried because that's the critical level.
Thank you, doctor. Moving to the next question. Do home remedies work to protect against COVID-19?
Dr. that's also another very good question because there is so much of confusion in people's mind. In fact, I wrote on my health page also on Practo, sometimes that prevention can be worse than cure. What happens is there is so much of misinformation, and that's the purpose of this webinar today. There are certain things I want to inform our viewers. Number one is that drinking hot water or kada or steaming throughout the day can be dangerous for you because your oral mucosa, these are substances that go to your oral mucosa, which is your mouth, and they go into your lung mucosa, which is your lungs. This is hot material. Kada contains many, many spices. You don't want to be doing too much of this. You don't want to be using very hot water because it will damage the oral mucosa, and damaged oral mucosa means the virus will find easier entrance into your tissue because the cells are damaged. Drinking hot kada is not recommended throughout the day. Maybe if you permit or if you want to, once or twice a day, and don't make it very spicy, don't keep it very hot. Steam inhalation is a good choice, especially if you have some congestion in your lungs. But again, not more than 2 times a day, and it should be carefully done. Particularly, I would not recommend for small children because they are not safe with hot water around them.
Thank you, doctor, for giving us a quick brief on that. Going to the next question. If infected, what are the best practices that can be followed?
So this is basically a patient who is infected and who is now in home care. We are recommending home care as the initial part of care. More than 90% patients are treated at home, and they don't need anything more than just simple practices at home. First of all, the person should be isolated. Secondly, the person should be made to have normal, nutritious, simple home food. Thirdly, there should be some interaction with the medical person who's coordinating the treatment so that the medical person can find out at the first sign of trouble, medication can be changed. Next, we have to understand that best practices means we have only symptomatic relief. Please do not start off on drugs which have no role. Even the WHO does not recommend certain drugs, and we are popping these pills on our own. We are ordering from the chemist. Please do not do that. They hardly have any role. This virus has no cure right now. There is no proven cure, only symptomatic relief. Fortunately for us, it runs a mild course, and over a period of time, the virus will go out of your body and you will be fine. Please do not rush and buy and start using medicines which are very little value and which may also harm you in the long run.
Thank you, doctor, for highlighting about taking wrong medications for or self-medication during COVID. Self-medication is never recommended. So let's move on to the next question.
Dr. Ajay, if I can just, one thing that we wanted to understand was immunity boosters.
Yes.
I get messages from patients and that, this, and they send me pictures of certain things. So can I take this immunity booster? Can I take this? And even those who are infected, the first thing that I'm seeing in their prescriptions is 2 to 3 supplements. For patients who are otherwise well fed, whose nutrition is all right, we don't recommend, nor is there any role for supplements. As long as you're eating well, your nutrition is good, you're eating normal, healthy home food, as long as you're resting enough, that is good immunity. You don't need to take supplements for immunity for 2 things. First of all, a supplement is only required if you're deficient in that particular thing. So if you're vitamin D3 deficient, you can take a vitamin D3 supplement under medical advice, and that's fine. That's recommended. You should do that. But if your vitamin B12 levels are normal, there is no reason for you to supplement yourself with vitamin B12 because it's just going to get washed out. Your body does not need it and will not use it. More importantly, nutrition from natural sources. So the nutrition we get from food that we eat is much more beneficial than nutrition we get from supplements. This has been carefully worked out. This is a fact we know from years together. So eat good food is much better advice than take supplement.
Thank you for that, doctor. So moving forward to the next question. Which numbers of the COVID-19 infected increasing exponentially day by day? What are the best practices that need to be followed to avoid getting infected?
So here we come to the crux of the matter. The number one thing is stay at home. Number 2, go out only if you have to. Number 3, if you have to go out, make sure you wear a mask at all times in public places. The next is, if you are going out, prefer to stay outdoors rather than indoors because outdoors is safer than indoors. When you come back home, make sure you wash your hands thoroughly with soap and water for a minimum period of 20 seconds so that the virus, if it is sticking to your body, is washed away from it. Your house should be well ventilated. Keep your doors and windows open so that there is cross ventilation which happens through and through. Maintain a good routine, eat nutritious food. Some moderate physical activity, if it is possible for you to do so, will help to keep you healthy and also give you some positive energy so that you feel better. And that's about it. There is no other magic bullet. The most important thing is to stay as far as possible away from other human beings, because the transmission is human to human. There is no other transmission. So the further you stay away from humans, the safer we all are.
Thank you, doctor. So, with the vaccines being accessible to people of all ages from 1st May onwards, why is getting vaccinated important?
So, Dr. Ajay, we'll start off with the primary question which people have, and I get these calls every day: Covaxin versus Covishield. Now, these are the two vaccines that are government approved. It is likely that in the near future, two, three more vaccines, including Sputnik, Johnson and Johnson, and Pfizer and Moderna, may be approved by the government. I think they have fast-tracked the process of approval of these vaccines. Once the government is certain that they are safe for our people, they will definitely approve them. So more and more vaccines will become available. Between Covaxin and Covishield, Covaxin is made in India. It's an Indian vaccine. It is given on day one, and then the second dose on day 4 weeks. Covishield started off by giving day one and on 4 weeks, but current recommendation is that the second dose can be delayed from 6 to 8 weeks for the second dose. Both vaccines are safe, both vaccines are effective. You should not worry about what vaccine you are getting. The more important consideration is that as and when you're called, whatever you've done to manage yourself to get a slot, you must go and get vaccinated. Both are good. Now, from tomorrow, 1st of May, vaccinations are going to open up. Obviously, we do expect a certain amount of confusion. It seems it has already started. I was in touch with some hospitals trying to get vaccinations for some of my patients, and I have been told that tomorrow it may not be possible because they're not very sure about how this is going to play out. So be patient. You have waited for a year, year and a half. Your turn will come. The process will get streamlined over a period of time. As with most such situations, there is likely to be a shortage in the initial instance, but that shortage will gradually ease out. So don't rush to the hospital on day one. Wait to see how the situation works itself out. Find out safe periods and slots for yourself, and then go subsequently. In the meantime, continue to follow safe behavior.
Thank you, doctor. So, moving forward, what are the best practices to get vaccinated?
So basically, there are just two things. It is the COVID app and your Aadhaar card. They have linked the vaccination with your Aadhaar card. So you open your COVID app, you use your Aadhaar card number, you find out they find out where you are, and then you are given a choice of centers which are near your house. You try and pick up one of those centers to find out whether you get a slot. As you get a slot, you book yourself and go there on the appointment time to get your vaccination. But this is in an ideal situation. I have been told and I've been hearing from patients that it's currently a little challenging right now to get slots. I think there will be clarity over a period of time. Don't be disappointed. Let a little time elapse. I'm sure this system will settle down over a period of time.
Doctor. Next question. We have been hearing about the Covishield and Covaxin. Which one is better?
Both are good. Both are good. Both are proven to be effective. There are speculations that the Covishield has caused some blood clotting in some patients, but nothing is proven. It is continues to be one of the most widely used vaccines all over the world. The Covaxin is an Indian vaccine. There were considerations that the Covaxin is probably working better against the mutant strain, but we don't know. I don't think anybody can say for sure. But if both are safe and effective vaccines, there is really nothing to choose between them. Whichever one is closer to you, whichever one is convenient for you, whichever one is offered to you, you should take it.
Yes. Thank you, doctor, for that. And it is very important that our focus is not supposed to be on which is the better of both, but we should focus on stopping the spread of the virus. I think that's supposed to be the takeaway message for everybody here, because if we get caught up on which is better, that might help only help in the spreading and delay the decision making process of actually getting the jab.
Very
right?
correct. Very correct. I think what you're saying
And
is very accurate.
also, the more you delay, you're at a higher risk of getting it, right? So I think we should take this question off our mind. And moving to the next question, should we take both vaccines, or can we mix the dosage between both, or crossover, because of lack of availability of vaccine or thought process? Your comments on that, doctor?
So, vaccine cocktail, it's an interesting concept. Nobody knows for sure. We don't know. There are people who have taken first dose of one vaccine and second dose of another vaccine. I don't think it is recommended, not because it may or may not be effective, but because we have to go by the trials. The way the trials were conducted and the way the approval has been given is first dose on day 1 and second dose on day 28 and for Covaxin, and that is approved as per the trial because the trials have been conducted in this manner. If we do anything beyond that or apart from that, we are not going true to this to what the trial has told us, and there are certain, we may be violating certain rules by going across and getting cross vaccinated. Having said that, I think there are people in the world who are considering this, and I really would not advise it. As I said, because scientifically it makes sense for you to stick with the same vaccine because it has been shown to offer a robust response. The jury is still out on that. I think it'll take us another year or so to find out how strong the immunity is by these vaccines. And over a period of time, we will know the pluses and minuses of each vaccine. And then maybe a year down the line, we can decide for ourselves. In the meantime, we should take whichever vaccine is offered to us.
Yes. Thank you, doctor. So to expand a little bit more further on this, the government has put in guardrails for the vaccination to ensure that we are within the safety limits of what has been tested and tried, right? We can go, venture out, but that will be at our own risk. So let us stay to the message and continue with what the government or whatever the safety reports have established, and let us continue to take the same vaccine as the same one as the first one, right? And not experiment by crossing over to the different strain of vaccine. Yeah. Moving to the next question. So there is a lot of information about speculation from the doctors with regards to the use of remdesivir and now rheumatoid arthritis drugs. What is your take on this, doctor?
So, Dr. Ajay, I'm glad we've got this opportunity to clear the doubts on this.
Yeah.
There were so many drugs which are doing the rounds, and as you can see, patients are by and large buying them, either keeping them home or using them at the first sign of infection, from doxycycline to azithromycin to ivermectin to Fabiflu to remdesivir and various other drugs that are available in the market. The government has brought out a very clear guideline yesterday from the Ministry of Health, and it has said that remdesivir is not meant for home use. Remdesivir is meant for use only in hospital. It is to be given intravenous. It is an intravenous injection. The WHO study also recommends the use of remdesivir, but only in in early severe cases. In critical cases, there are studies which said remdesivir has increased mortality. So obviously, this is critical decision making. We should leave it to our ICU and critical care specialists who deal with these patients day in and day out, and who are very well trained to know what is the right time to give this dose. And we should not experiment with these drugs at home. They are not necessary. They may sometimes cause complications, and we are better off letting this decision making be taken by the team that is handling you when you are in the ICU.
Thank you, doctor, for that. And what we see nowadays is a lot of people are, desperately looking for remdesivir, for their loved ones and near and dear ones who are sick. Um, we see a lot of WhatsApp messages, phone calls coming from patients and etc. for requesting where can we find this. One message here is it is tightly controlled by the government, right? The supply of this. It is directly being supplied to the hospitals. It is currently not being sold to individuals and pharmacy to avoid, hoarding of these drugs at home or, for all the wrong reasons. So I think we should leave it to the hospitals to, chase down and get the required dosage for your near and dear ones. So I think that's another message that I wanted to share with the group here.
Dr. Ajay, I'll use this opportunity to also say that the kind of self-medication that is going on for a disease for which the world over nobody knows the cure. So,
What
as I was
works?
discussing with my other colleagues, this is a disease. It seems apart from the doctors, everybody else knows how to treat it. Self-medication is rampant, and that is probably a little dangerous thing because since most medicines are not effective. If you remember, we started off with this great promise of hydroxychloroquine when the
Yes,
pandemic struck, and over a period of time, study after study, research after research said that the drug actually causes complications, has serious side effects, and is probably not very effective. And so we keep experimenting with things, and because of our hopelessness in tackling the situation, and because no medicine is known to work, we keep experimenting with various drugs, whatever seems to be coming on social media, whatever our friends and family are sharing on WhatsApp groups, and we seem to think that that is gospel and that is going to work, which is not really true because most of these things have not stood the test of time. There are certain things that work, first, particularly symptomatic care. Secondly, monitoring the patient well. Thirdly, if the oxygen levels fall, you must be very, very vigilant and you must try and arrange either for oxygen or for a concentrator or take the patient to a hospital where better care can be given. And these are messages that we need to understand. We should not be starting medicines on our own.
exactly, sir. So we have heard of many instances where wrong dosage has been taken by the patient, or purely because of misinterpretation or misinformation, right? Both are misses which will literally cost your life or disability, right? So let's leave the treatment to the professionals and avoid self-medication.
Yes, I mean, I have anecdotal instance of a patient who was taking 80 milligram of methyl prednisolone on her own,
Wow.
and she was mildly symptomatic. So imagine the kind of side effects this kind of self-medication can cause.
Yeah.
We should avoid this. When medical help is available, e-consultation is available, when you have doctor at the drop of just one phone call, I think you should make use of that and authenticate the information that you have. You may have questions. Please ask your physician. Please ask your doctor all the questions. I'm sure he or she would be more than happy to answer your queries.
Thank you, doctor. So moving to the next question. Can the COVID vaccine affect your menstruation cycles? So this is one of the most popular, questions asked by women. And your thoughts about it, doctor?
So let's clarify about the vaccine. Who should not take the vaccine? Those who have an allergy to and particularly severe anaphylactic reaction to any of the components of the vaccine. Number two, those who are currently infected or just recently infected with the vaccine should avoid taking the vaccine. Pregnant ladies and breastfeeding mothers, not because it is not safe for them, but because trials have not been conducted, being a very ethical and a sensitive issue, trials have not been conducted on this subset of population to know about the efficacy and safety of the vaccine. Trials are currently on, and once the trial reports are out, we will be able to offer to others also. Children below 18 should not, again, not because it is not safe, but because trials have not been done, again, being ethical issues on doing trials in children, we have not been carrying out adequate trials to know whether the vaccine is safe and works for children or not. Again, these trials have also started. We will know in a short period of time. Apart from that, anybody else can take the vaccine. I get calls from patients, doctor, I am diabetic. Should I take? You're more, there is more reason for you to take because you're diabetic, you're more at risk. You have a serious comorbidity which makes you have a serious form of the disease. You should definitely take the vaccine. I'm asthmatic, should I take? Of course you should take. During periods you should take. There is no problem at all in that because this is not hormone. This is just a simple inactivated virus that is being injected into your body. It causes mild symptoms on day 1 or day 2 of the vaccination, from fever to a little muscle ache and sometimes pain at injection site, and that's about it. But after that you have good immunity.
Yes, doctor. So moving to the next question. Can pregnant women get vaccinated? I think you've just answered that. And moving to the next question, does the does the vaccine negatively impact women who undergo menopause?
No, there is no such. There is no study which has proven that.
Thank you, doctor. So next question, I think we have reached the determined list of questions. Now we have some questions from our audience, and I think it's time for us to go through these, doctor. And the first question is conjunctivitis actually a symptom of COVID?
So that in the new second wave of this virus that has come in the mutant wave, there have been sporadic reports of redness in the eye, but this is mild, it is temporary, it clears up within a day or two, and it's not a serious symptom. It should settle down. Yes, but yes, redness of the eye is one of the newer symptoms of the second wave.
The next question here is, should we wear masks at home as directed by the government?
See, this is a little controversial. It's you have your children in the room, you're going to sleep. That means you will be sleeping with somebody else next to you in your room. Could be your brother, your sister, your spouse. So during when you go to sleep also, should you take off your mask? So first of all, these are not practical to adhere to. And we hate wearing masks, you know that, Dr. Ajay. Everybody hates wearing a mask. It's uncomfortable, it prevents you from speaking very clearly, you feel suffocated, and if you're claustrophobic, it's practically impossible for you to wear a mask for long periods of time. Masks are uncomfortable, they are necessary, they are preventing the spread of the infection, so we wear them. But it's impractical to presume that we will be inside the comfort of our homes and we will mask ourselves. Yes, there are certain indications. If you've been out and you don't know whether you have an infection and there are elderly people at home, when you go to meet them, make sure they're wearing a mask and you are wearing a mask. Secondly, make sure that your house and is well ventilated, doors and windows are open so that the virus, even if it comes in, will be easy for it to be filtered out. These are more practical considerations.
Thank you for the insights on that, doctor. And the next question is, once a COVID positive person is isolated in the room, how do we sanitize everything in the room once they are cured?
Right. So this, first of all, because we realized that this is more by droplet infection and that surface transmission is not so prominent, it is left for us, first of all, to open up all the doors and windows and let the air in and ventilate the room well. Let the sun come in, let the breeze flow through the room. The bedding, particularly all the linen, the bed covers, pillow covers, must all be washed in boiling water along with some disinfectant. All the surfaces, including towel racks and cupboard surfaces and bolts and all, must be thoroughly sanitized with either spirit or hand sanitizer, which contains minimum of 70% alcohol. If necessary, keep the room open and let it remain like that, unoccupied for a day or two. And after that, you could occupy it. It should be safe. I don't think there is any much of surface transmission happening. You should be all right. Just simple hygienic precautions is all that you need to take. You don't have to do more than that.
Thank you, doctor. The next question from the audience is, if someone who has already been cured from COVID-19, can they be affected again?
Breakthrough infections, Dr. Ajay, you are also aware. Yes, this
Yeah.
is, we are in this present stage. I have seen at any given time many patients who had COVID in the first wave and have COVID again now. Breakthrough infections we are also seeing in vaccinated patients, not those who are 2 weeks beyond their second dose, but definitely those who are in between doses are also getting infected. So there will be breakthrough infections. People who have got infected in the first wave are getting infected in the second wave, and those who've received their first dose of vaccine are also getting infected. And that is why we cannot depend upon any kind of level of immunity. We need to continue to be very, very safe. We need to continue to wear masks in public places, and we need to follow all respiratory etiquette and hygiene and all safety protocols as the government brings out for us.
Yes, doctor. Talking about patients getting infected in between vaccinations, I've recently come across many patients who have gone to the vaccination center and got their vaccine, and the seventh, eighth day they're infected or they're positive with COVID. Right? There are many debates about how they got it. Probably they didn't maintain their social distancing, or they're going to a premises where there is a lot of infection. A healthcare facility or a hospital is going to definitely have a lot of infections. So that's another caution that we need to take. When we are especially going to get vaccinated itself, you're still not built the immunity, right? It takes about 30 days to 40 days or maybe even 60 days to build your immunity towards
Two
COVID-19.
weeks after the second dose.
Yes, so it takes about a few weeks, 2 to 3 or 4 weeks. That's why we have a booster to add on to the we should not take things lightly just because we have taken our first vaccine. So that's again a very important takeaway message to this group. Now, the next question that the audience wants to know is, what is the CT value? What does it mean? Or what should a common man understand from this?
We will talk about, see, the confusion is that there are two CT values actually which are floating around. One is the CT value of the RT-PCR test that is done, and then it shows how many cycles it has gone through before it turns positive. And the lower the number of cycles which it goes through and becomes positive, the more the viral load, so more the infection. But there are so many variables, Dr. Ajay, and I'm glad we bring this question up because we can clarify to our viewers that the CT value is not, so this is not, the ICMR has repeatedly said, this is a qualitative test, it is not a quantitative test. So the CT value is mildly indicative maybe of the kind of infection you have. It is not such a clear indicator because there are many things which will cause variability. Number one, the day on which it is tested. So if you test on day 1 or day 2 and the viral load is not replicating as yet, you may get a lower infection. So your CT count may be high. Number 2 is the technician who tests you. If he's not careful in taking the probes deep enough, you may get a higher CT value, which indicates lesser infection, in which though you may be much more infected than the CT value indicates. Number 3 is the transportation, the way that particular material is transported and how soon it is tested, and also the testing methodology. So there are so many variables in the CT value that I would not put too much of stress on my CT value to say, doctor, it is 18, I think I'm very infected, and doctor, it is 24, I think I'm mildly infected. I think we should just consider that positive is positive and don't lay too much stress on CT value. The second CT value is the CT chest that we carry out. The CT chest, as we discussed, is a fairly sensitive method of picking up COVID-19 patients. And there are certain various categorizations that they've got to tell us the severity of the disease. There are various protocols that are being used. And based on those protocols, they will tell you whether you have a mild, intermediate, or severe form of disease. That is another CT value, which is a CT value of CT chest. And both of these are for consumption of healthcare workers or your medical personnel. I don't think you should read too much into them. And another advisory, please do not get CT chest done yourself. Please get a CT chest done only if your doctor asks for it.
Thank you, doctor. So some of the audience member want to know, what is the classic symptoms or how do you detect COVID from a CT, from the a CT scan?
So as I said, basically there are ground glass opacities and there are various changes that happen in the CT scan. But I would not like to encourage going further down this path because let the radiologists do that. It's difficult enough for them. Everybody is swamped with work. They have their own, it's a highly technical field. They have their own way of judging about the severity of the disease. They are experts in this. And even I would not be able to tell you as much as a radiologist would. So I think we should leave it to them and not go there at all.
Thank you, doctor. So I think one of the audience member, Dr. Saurabh Sharma, is asking is oral thrush and fatigue could be a symptom of COVID second wave?
So let me answer this by saying fatigue definitely is a very common symptom of COVID-19. Oral thrush may be a secondary complication if you have been advised or if you are taking inhaled steroids. The oral thrush may be a secondary complication or a side effect of the inhaled steroid because that lowers your oral immunity and causes a secondary fungal infection. That is why we always recommend if you're using oral inhaled steroid, use a spacer and always rinse your mouth after using the inhaler so that any residual glucocorticoid or corticosteroid in your system, in your oral cavity is washed out. That's very important. And in certain instances, that is why nebulization may work better than an inhaler because it definitely transmits itself better in the lungs.
Yes, doctor. So another member is asking, um, is sore throat and gastric symptoms part of COVID-19 symptoms? And to add on to that, are there any home remedies for handling sore throat during COVID-19?
So sore throat, yes, is a prominent symptom of COVID-19. We are seeing in this current lot of infection, many patients are complaining of nausea and vomiting, and some have got loose motion as well. So this is, we expected that to happen because there are a lot of ACE2 receptors in the intestinal tract, and that is where the virus attacks. As far as sore throat in the oral cavity is concerned, povidone iodine is a germicidal agent. Not only is it germicidal, we found that even very, very small concentrations of povidone iodine kill the virus. So we recommend that you gargle with povidone iodine 2 times, or you can do simple normal saline gargles at home, and that would be effective also.
Thank you, doctor. So another audience member is asking, is there a different line of treatment or an approach for diabetic patients with COVID?
See, diabetic patients are what we call high risk patients. In high risk patients, we need to be more careful because they can have a more serious form of the disease and they can deteriorate rapidly. So we certain drugs that we don't normally give to non-diabetic patients, we may give to diabetic, particularly a prophylactic antibiotic, because we want to keep them safe. We want to keep them away from a secondary infection. And so the decision should be taken by your physician. And it's possible that in a diabetic, we may want to start an antibiotic early so that you don't get a secondary infection, particularly in the lungs.
Yes, doctor. Another question is, if I have tested for COVID-19, when can I get vaccinated or how long should I wait?
So the CDC recommendation is that if you have COVID-19 and you have not received even one dose, you should wait for 90 days. The second recommendation is if you have received your first dose and after receiving your first dose, you become positive for COVID-19, you should minimum, you can go for the slotted time, but you should minimum wait for the quarantine period to be over. And definitely you should be asymptomatic. And after that, you can go. So suppose as we were discussing about your patient who fell sick on day 10 of taking the first dose, then we presume that day 10, the patient is sick, 14 days illness, and this patient should be able to go at the regular 4 week for the second vaccine or 6 to 8 weeks, depending upon which vaccine he has taken. And so that would be possible.
Thank you, doctor. So another, very interesting question that many people are asking is, when do we get ourselves retested, right? After 10 days or 14 days of treatment. So when do we get ourselves retested for a negative report?
My request to you would be that, first of all, day 14 to 15. So day 14 is when you will be having the last day of the illness. And from day 15, you should presume yourself to be negative. You don't need to get yourself tested because, first of all, we consider that this infection goes on for 2 weeks and then you are not passing on the infection to others. And secondly, because the testing facilities are so badly choked up that to just go for a routine test, it takes 2 days for somebody to come home and 3 more days for the report to be available. The practical thing is day 15, consider yourself free from the disease and you should be all right.
Thank you. So another user, Ashu, is asking how important is the inhaler if I'm having allergic bronchitis, though not corona positive, but I'm feeling very heavy breathing or feeling difficulty in breathing.
So this is a medical situation again where I'm sure being an asthmatic, the patient is under care of a doctor, and this advice they should take. But allergic bronchitis, yes, an inhaler is an effective treatment, but they should take it under medical supervision and not try to experiment on their own.
Thank you, doctor. And another user is asking about um, the CT value scores. You know, for one of the patients who is having 13 out of 25, right? What do you have to say about the severity and etc.?
So I think again, Dr. Ajay, we should not actually. This is
Agreed.
not a forum for treating patients. This is a forum for information. I
Right.
think it would be a little misguided on our part to, in an active, open forum like this, to treat patients. I
Yeah.
think they would be well advised to take treatment from their regular sources, and that is my request to them.
Right. So another interesting question which has come up, doctor, is do we need blood thinners after recovery from COVID?
So blood thinner is a critical decision making in management of COVID-19, and this is the situation where we actually use markers to find out whether you need this or not. And this is normally done in a hospital setting. This is normally done by a team of critical care and ICU specialists who will decide whether you need it or not. It's not a casual decision. It's not a decision we should take. Even mild to moderate patients don't require blood thinners. I don't think we should go there at all. This is a very, very critical decision which has to be made by persons who are highly trained in managing this disease, because blood thinners by themselves have their inherent set of problems. The decision making to start a blood thinner is very critical. The timing has to be right, and it has to be taken by experts. We should not be delving into that or guessing about it at all.
Yes, doctor. Thank you. So I think we are almost reaching to the last question that we have, last set of questions that we have received. But there is one last interesting question. It's up for debate again. Will there be a third wave? That's doctor.
The second wave is depressing enough. It is,
Yes, I
we
agree.
cannot imagine how overwhelmed we all are and how overwhelmed the people are, how overwhelmed this whole country is. There are certain pockets which are much worse off, particularly like in my city, in Delhi, which is reeling under the second wave. And it's really heartbreaking to see what is going on. I don't think we should think about it. If we behave responsibly, if we get
Yes.
vaccinated, if there are enough vaccines to take care of us in the next 3 4 months, that is the only way for us to achieve herd immunity. If enough number of people get vaccinated in the next 3 to 6 months, that is the only way for us to beat the third wave, because that's the only way to achieve some kind of herd immunity.
Yes, doctor. I agree with you. And I think the takeaway message here is to stick to what the government and the researchers are telling us with regards to getting vaccinated. Do whatever is required to break the spread, right? We have to break the back of coronavirus by stopping the spread. We need to, maintain social distancing, practice very good hygiene, get ourselves vaccinated, and follow what the medical professionals are recommending when a treatment is recommended. Do not self-medicate. I think these are the core principles that should be the take-home message for all the audience here today. I hope you agree with me, doctor.
Absolutely. And apart from don't self medicate, please do not hoard essential drugs,
Yes.
essential things which are life saving, oxygen cylinders. Please let them be used by people who need them, who are gasping for air, who need oxygen. Do not try to hoard critical medication which is in short supply, because people need them desperately.
Right. I think this has been a wonderful session, doctor, and I would really, with heartwarmingly thank you for this wonderful message and the information that you have given to all our audience here. And so So I think we are reaching our end of this session, and thank you for attending this session. Dr. Bharatwaj, do you have any closing message from your side?
More than 90 to 90, more than 90, between 90 and 95% of sufferers of COVID-19 will have a mild to moderate form of the illness. 95% and up to 95% patients will be treated in home care. Home care means standard of care is basically symptomatic treatment. No drug is known to work against this virus. So just take symptomatic relief. If you have fever, take an anti-fever medication, paracetamol. If you have symptoms of acidity, take an antacid. If you have a cough, take a simple over-the-counter cough suppressant syrup. Maintain a good positive attitude. Eat healthy, nutritious food, and you will be fine. You will come out of this infection very well. Do not get unnecessary tests done. Do not take unregulated medication, and do not go for CT scans when you don't need them. Let your doctor decide all these things.
Thank you, doctor. So we can very clearly see the significance of sharing information from medical research and our own clinical experience. And it is very, very important at this current moment that everybody absorb it and implement it in your daily life. So once again, thank you, doctor, for sharing this information. And I would like to thank the entire audience here for being with us and hearing us out. And on behalf of uh, Practo and the entire team, we would like to thank you for joining us today. And we hope you found this information and dialogue valuable in fighting this battle. Together, we should all join together and be able to win this in a very short duration and not allow it to be a long drawn affair. So thank you for being with us today evening. And I think we shall close this session with this.